There is an infusion center in eastern Travis County where high-risk COVID-19 patients can get this antibody treatment before they get seriously ill. And next week, a company plans to launch the same treatment delivered directly to you. Monday, an infusion center opened at the Travis County Expo Center. So far, 19 people have been treated there. It's where high-risk COVID-19 patients can get monoclonal antibody treatment early in their diagnosis to help keep them out of the hospital. It's the same treatment Governor Greg Abbott is receiving.
As you may have heard by now, I have tested positive for COVID-19.
We don't know where the governor was treated, but across the state, more COVID-19 patients are being treated at home. Texas-based company CoreMed operates like Lyft or DoorDash, except their deliveries meet medical needs.
We don't deliver people, we don't deliver food, we don't deliver grocery. We are healthcare specific.
CEO and founder Derek Miles says the company delivers vaccines and monoclonal antibodies in Houston and Dallas. They're expected to start antibody deliveries in Austin next week through a partnership with the company Curbside Infusions.
These are nurses who would actually come into your home and provide that infusion. It lasts about an hour.
It's a tested treatment for immunocompromised patients. Doctors say it's costly and no substitution for the vaccine, but it can help reduce the strain on area hospitals.
That is the goal, that, you've got this high-risk person that has symptomatic COVID and they receive a monoclonal antibody so that they don't get admitted.
And this on-demand treatment can cost up to $600 if you want it delivered same day. It's a bit cheaper if you have insurance and can wait a couple days. You do need a doctor's order to get it, whether you're using a private company or whether you're using that state-run infusion center. If you're uninsured, you can receive a doctor's referral to that state facility by going to community care or People's Community Clinic. There, the treatment is free of charge.
Well, they tell me that answer is still in the works. Nicolette was supposed to attend Westlake High School as a freshman, but that all changed when her parents found out 2 teachers refused to wear masks.
Do you want to go to school or do you want to stay home?
School. Nicolette Sabrin was born with cerebral palsy and later diagnosed with autism. Most recently, her family says she was diagnosed with a rare disease, which is a deficiency of CTLA4.
Her doctor from Texas Children's Hospital, Dr. Ivan Chin, wrote a letter asking or stating that any teacher that works with Nicolette needs to wear a mask while she works with Nicolette.
Ben Sabrin, Nicolette's dad, says they've been working with Eanes ISD on her return to school and recently learned 2 Westlake High School teachers she'd be learning with refused to wear masks. The district does have a mask policy in place.
We think that the district has done the right thing by putting a mask mandate in place. That said, their hands are tied.
And I don't understand why a teacher, at the bare minimum, wouldn't wear a mask to protect her students.
With virtual learning not an option and minimal homebound learning offered, the Sabrin family says they're left with little to no answers.
The biggest problem with her getting COVID is that at Texas Children's Hospital, where her doctor would treat her, there's no hospital beds to treat her. I couldn't imagine losing her.
The family is now looking at having Nicolette only attend the classes where teachers are wearing masks.
I don't know how to get her the credit if she has to be there 75% of the time, but she can't be there because the teacher won't wear a mask. And they're telling me if she's not there 75% of the time, she can't graduate high school.
The district has said they can enforce the mask policy based on Governor Greg Abbott's orders. They also said they can't go into details, but are doing everything they can to provide the best learning experience for Nicolette.
With nearly 40,000 students in San Marcos, keeping COVID in check at Texas State University would go a long way toward keeping Hays County healthy. Across the country, hospitals are crowded with COVID patients, and Hays County has already surpassed their COVID hospitalization numbers from the last wave. The county judge there recently ordered masks be worn in schools, saying in a statement, "I am concerned about the health and safety of our children and our hardworking faculty and staff members in our ISDs and hospitals." And today, Texas State University announced its plan to keep COVID at bay when the fall semester starts next week.
Everything is in shape for a 100% capacity for classes, buses, and other venues, events, and meetings.
But to keep occupancy at 100%, students will have to get used to frequent COVID testing. They're recommending every other week.
Our expectation is that everyone, regardless of vaccination status, will test periodically throughout the fall semester.
And Texas State will continue serious contact tracing, too. Their protocols have helped them prevent COVID infections on campus. But what about off campus? The ACL Festival just announced it'll require a negative COVID test for admission. Texas State isn't doing that for on-campus events yet, but that could change.
As we review the situation weekly, if we see problems developing, we will adjust our operation. We will adjust what we're asking people to do on our campus.
They say there has definitely been an uptick in the number of people getting vaccinated, either first or second dose, and wearing their masks. And they say the impact is starting to show up in their data.
The COVID-19 situation in Austin has been described as dire by health officials. But today, UT researchers said the outlook could be improving.
We're at a very, very uncertain moment.
Dr. Lauren Ansel Myers leads the research team at the UT COVID-19 Modeling Consortium. The median projection, shown with the blue lines on the right side of the screen, indicate that both hospital admissions and the number of ICU patients could drop over the next month.
This recent slowing, maybe even a downturn, but at least a slowing in the rate at which the admissions are increasing is a positive sign that some of the public health messaging, some of the changes in staging is having the desired effect of changing behavior and slowing transmission.
The biggest variable right now is how the start of school will impact new cases and hospitalizations.
It is very possible, very plausible that as children, young adults gather in large groups for the first time with or without face masks, that will amplify transmission and exacerbate the current situation.
During today's town hall on the Delta variant, health experts also weighed in on the need to get a third dose of the Moderna or Pfizer vaccines.
We know that giving a third dose increases your antibody levels by a lot.
Dr. Parker Hudson with the Dell Medical School says the federal government may recommend a half dose of Moderna as a third dose.
A half dose gives you a drastic increase.
Dr. Hudson says they need more data to know the best strategy to get the most protection, but says early indications don't show there are additional risks.
The third dose seems to be tolerated well and is very similar to the second dose as far as side effects.
Now, in addition to the start of school, one other variable that could impact this plateauing or even possible decline is the start of flu season. Health officials say they're going to have to watch both of those things very closely to see how we're going to trend over the next month.